this important conversation. Tonight is about more than a meeting. Tonight is about our community's future. For generations, Santa Paula Hospital has been more than just a building. It's been a place where our children were born, where our elders received care, where families turned during emergencies, and where our community found dignity, compassion, and hope. Healthcare is not a luxury in the Santa Clara Valley, it's a necessity. That is why we are here tonight to ensure that our hospital campus remains strong, accessible, and responsive to the needs of working families, seniors, farm workers, youth, and every resident who calls this valley home. The stakes are real. Our community deserves quality health care close to home. We deserve transparency, strong communication, expanded behavioral health and human services, stronger medical outreach, and a vision that protects long-term future of healthcare access in our region. This forum is an opportunity for our community to listen, speak, ask questions, and advocate together. And tonight we are honored to be joined by leaders who understand the importance of community voice and civic engagement. As we continue this evening, we will have question cards in the back. If anyone needs to ask a question, we have Christina waving her hand back there, and just raise your hand and she'll get a question card to you with a pen. At this time, it is my privilege to introduce Santa Paula City Council Member Pedro Chavez.
Thank you, and thank you everybody for showing up. Again, I'm here representing the Santa Paula City Council. We've been a partner in the conversations of the California community. Unfortunately, the mayor and the vice mayor were not available. Blue Ribbon Committee. And I'm here again, sitting and talking about this for years. We've had conversations. Ultimately, we need the community to raise their voice. Advocate in the future they want. You have to know who to advocate to. I'm here to tell you that 5 people are going to be making the decision on what the future is going to be. 800 South Victoria Avenue, Board of Supervisors. We need our voices throughout this entire valley. The folks that have lived here for generations, the folks that have lived here now, we're all in this together because we need access to quality health care in our community, especially in a community that is most disadvantaged. So I urge you to have kitchen table conversations, to raise your voice, be active, and ultimately, when it's time to show up, we need to be there and advocate for our strong position, because I can't imagine a future where our families don't have access to health care, where they have to go to another city, put that burden in another city. And so again, on behalf of the City Council, we're actively involved in this conversation. Today you're going to hear these caring, compassionate people talk about the issue, but ultimately, people who raise their voices, that stand up, and we really need everyone. We're at a critical stage. So thank you everybody, thank you Latino Town Hall for your leadership. Thank you everyone who's been part of the conversation for years. And so we're at a place now where there could be more progress, but we need to make sure we have access. Thank you.
Thank you, Councilmember Chavez. Tonight, our first community presentation will help ground the conversation in both data and lived experience. We are honored to begin with community voices and concerns from residents and healthcare advocates who understand firsthand the importance of maintaining a full-service hospital campus in Santa Paula. Our first speaker is Ms. Shira Jones, Executive Director of Health Equity, Gold Coast Health Plan. Shira Jones has been a strong advocate for healthcare equity and access throughout Ventura County and brings an important perspective on the healthcare needs, disparities, and opportunities facing our community. Please join me in welcoming Ms. Jones.
Good evening. Tonight's conversation is about healthcare access, equity, and community impact. Healthcare access should not depend on race, income, or zip code, yet we continue to see communities of color and rural communities experience greater barriers to timely care and essential services. As conversations continue around healthcare access in Ventura County, it's important to understand how reducing local access can disproportionately impact vulnerable communities. Before discussing Santa Paula specifically, it's important to recognize that healthcare inequities already exist. Communities of color are more likely to experience barriers accessing healthcare services. These barriers can include transportation challenges, provider shortages, delayed care, and fewer local health care resources. Many working families already face difficult choices between taking time off work, arranging transportation, or delaying care altogether. Local hospitals often serve as a critical access point for communities that already experience inequities within the healthcare system. When healthcare services move farther away, the impact is not equal for every family. During emergencies, every minute matters. Longer travel distances can delay treatment during critical situations, such as heart attacks, strokes, accidents, or pregnancy-related emergencies. Rural communities across the country have already experienced hospital closures and reduced access to care. For families with fewer resources, limited transportation, or caregiving responsibilities, distance itself becomes a healthcare barrier. 10 miles may seem significant on paper, but during an emergency, that distance feels much greater. Next slide. Many rural and agricultural communities have experienced generations of underinvestment in healthcare and other essential services. Communities that help build local economies, including farm communities, often continue to experience fewer healthcare resources and ongoing disparities in access and outcomes. For many residents, concerns about losing local healthcare access are not isolated concerns. They reflect a broad pattern that communities of color have experienced for years, losing resources instead of gaining investments. Equity means recognizing those historical patterns and ensuring communities are not left behind. So this brings us to Santa Paula. Santa Paula is a predominantly Hispanic and working class community. Many residents already face transportation access challenges. If residents are required to travel farther for emergency or hospital care, the burden will likely fall hardest on seniors, low-income families, individuals without reliable transportation, and medically vulnerable residents. Again, 10 additional miles may impact families very differently, depending on their resources and circumstances. This is why healthcare access is also a health equity issue. At the end of the day, this conversation is about protecting equitable access to care. Every community deserves timely, local, life-saving healthcare services regardless of income, race, or geography. Healthcare access is not just a convenience. It is part of the community's safety net and overall well-being. As decisions are made about healthcare services in Ventura County, it's critical that community voices and equity considerations remain part of the conversation. No community should lose access to life-saving care because of where they live. Thank you.
Thank you, Shara, for helping center this conversation on health equity and the needs of our community. Our next speaker is Marianne Crowley, Chair of the Santa Clara Valley Together and the Santa Paula Hospital Blue Ribbon Committee member. Marianne has been a strong advocate for collaboration, long-term planning, and protecting vital community resources throughout the Santa Clara Valley. She served this community in so many capacities, including as a council member. Her commitment reflects the spirit of partnership that tonight's forum is built upon. Please join me in welcoming Marianne Krause.
Put the hospital in context in the community. First of all, hospital planning before this building on the hill was developed started in 1958, and it started because physicians were concerned about the lack of facilities in the community. There was a maternity home on Main Street, and a number of people in my generation were born there. But there was a problem. Anytime there were complications, either to mother or baby, doctors ended up needing to needing to ride in the back of ambulances to a hospital in Ventura. And sometimes mother or baby did not make it. We think about the changes in healthcare, and we have a lot of improvements, like having paramedics and having blood available in the latest ambulances. But women's bodies haven't changed that much, and infants' bodies haven't changed that much. And so those are still problems that need to be addressed properly with healthcare. So in the late 90s, maybe the mid 90s, the hospital started to struggle. We had many patients who did not have access to health insurance. And when they did have Medi-Cal, the reimbursements were too low to cover the costs that the hospital actually had. At the same time, the hospital was contracting with a private company for its executive services, and that was very costly for the hospital. In 2002, the hospital announced that it was going to be bankrupt, and it began looking for partners, either to work with them or to actually purchase the hospital. Unfortunately, most of the partners, well, none of the partners were interested in operating a community hospital because there just didn't seem money in it. Too many of the partners said, oh yeah, we'll operate it for 2 years. But when you looked at the history, they were selling off hospitals for parts. It was basically a scheme to make a lot of money and disappear. So those were not options for Santa Paula Memorial Hospital. When the hospital went bankrupt in 2003, the county purchased the building and the adjacent land out of bankruptcy. The hospital had 17 adjacent acres, which were vacant, which were all donated by the community and were intended for a skilled nursing facility and maybe some senior housing. The county paid $2.75 million for the hospital and all of the vacant land. And they sold the vacant land to a developer to build housing for $10.6 million. So they more than recouped the original purchase price several times. In 2019, the county announced that they were going to be closing the maternity ward. And that was of great concern to our community. We are a growing community and we have a lot of people still have children in this community. Latino Town Hall formed a coalition to address this issue with the county and look for other partners who might be able to help. A plan was developed to try and keep the maternity ward open. It did close for a couple of months. We got it to reopen. Part of the plan was to develop a midwife program, which would attract people to the hospital. But many of those plans were not sufficient to bring enough birthing mothers to the hospital to keep the facility, to keep the maternity ward open. So during that time, right after we got the maternity ward reopened, Supervisor Billy Long sought to form the Santa Paula Hospital Blue Ribbon Committee, which still exists today, and many of us in this room serve on that committee. And we've been looking at the statistics and trying to make suggestions on how to keep the hospital alive over that time. The committee and Latino Town Hall sponsored forums in Santa Paula and Fillmore to ask the community what they wanted for healthcare in the valley. Those forums were held at the very beginning of 2020, before the pandemic. And the communities were very clear that they wanted a new hospital, one that was more accessible for everybody, because driving from the freeway up the hill can present a delay in treatment in itself. So the county began working with Limoneira, and Carol Edwards will talk about that for a moment. But the county, Limoneira, and Limoneira's consultant presented plans, preliminary plans for a new hospital in September of 2021. And we have been working on that expectation ever since. In the fall of 2025, this past fall, the Blue Ribbon Committee learned that the county was no longer working with a consultant on planning a new hospital. That was news to us. It was just a little footnote on a PowerPoint slide. No real discussion of that occurred at that time. We also learned that the county CEO's office, when they made a presentation to the Board of Supervisors, was talking about not only abandoning the idea of building a new hospital, abandoning the idea of earthquake retrofitting the existing facility, but also abandoning the idea of building a clinic building, which had been planned as a part of the whole hospital campus. The clinic building would have consolidated the maybe 5 or 6 clinics that the county has in Santa Paula. They're broken up and spread all over because there isn't one appropriate facility. The county back in the early 2000s was looking for a building to put a clinic in and couldn't find one, and came to the conclusion that they needed to build a clinic building. And that was the plan that started in 2019. But suddenly, this past November, they went back to the idea of maybe there's a building somewhere. So we're in that sort of circular problem. There's been a lot of changeover in the county CEO's office, a lot of changeover in the healthcare agency, and no understanding in why that there is a building that's appropriate at this time. 8 of the 10 cities right now have a hospital. That's an amazing statistic to me. Fillmore and Moorpark do not. If we lose this hospital, then you can look at the entire Santa Clara Valley, which is over 55,000 people right now and growing. And we would be the largest market in the valley, in the county, without direct access to emergency health care and traditional hospital services. We believe that that's problematic from an equity standpoint because we have some of the least privileged people in the county right here in the valley, and for them to not have access is unacceptable. We know that it's difficult to run a community hospital at this point. The big beautiful bill has really made it difficult to finance healthcare in general. We know the statistic that 55% of the revenue for the two hospitals, BCMC and Santa Paula Hospital, 55% of the revenue comes from Medicaid, and that money will be going away over the next 8 years or so. But we feel that failing to plan for the future needs of this family is not an acceptable plan. If we feel like if this were happening in another part of the county, that more attention would be put into developing a plan and seeking the resources when timing appears more advantageous. So a failure to plan is not acceptable. Thank you.
Thank you, Marion. Our next speaker is Daisy Rojas, public health worker, scholar, and researcher with a concentration in epidemiology and a member of the Santa Paula Latino Town Hall. Daisy brings both academic insight and community perspective to tonight's discussion. Her work reflects the importance of data, prevention, and culturally responsive healthcare systems that truly serve our residents. Please join me in welcoming Daisy Rojas.
Hello. So my background is in epidemiology. I did a lot of statistics research, and I conducted the health needs assessment for the Tri-County areas. So I have conducted a lot of research into statistics of the Ventura County overall and comparing it to the Santa Paula statistics. So one of the big data points that I wanted to point out is adults with diabetes in Santa Paula. We have a higher rate of diabetes in the city. It's at 14% of adults in the county or in the city have diabetes compared to the 11.4% in the county overall. As we know, with diabetes come a lot of other comorbidities, which can include the increased rate of stroke and other heart disease. So when discussing closing down our hospital system, it's really concerning, especially considering the critical timeline that comes with stroke care after stroke. So with that in mind, adults in Santa Paula are we have a 3.4% of adults that experience a stroke annually compared to the 3.1% in Ventura County. And that first hour, as many of you may know, is critical in minimizing long-term damage to the body. So when looking at that, it's really important because, as many know, 1/3 of all U.S. deaths are caused by cardiovascular disease. Along with the diabetes rates, we also look at the hospitalizations due to diabetes. So in Santa Paula, we see a rate of 24.3 Santa Paulans out of every 10,000 that are hospitalized annually for their diabetes and for other comorbidities. In Santa Paula, we also see a hospitalization of 30.2 out of every 10,000 that are hospitalized due to heart failure related to that diabetes. And other important statistics to look at is our ER rates in Santa Paula. Just last year, 26.2% of Santa Paula residents visited the ER. So closing down a service like that is crucial to accessing quality, accessible healthcare is very concerning. Along with that, for our adult population, we have seen an increase in adults having delayed or difficulty obtaining care annually. So within just 1 year, we saw a jump of 4.4% difference from 1 year to the other in our adult population, that being anyone over the age of 18. And with children, we saw an increase of 1% from 1 year to another. Closing down the hospital would only increase that number that we are seeing and would continue to cause a delay or difficulty in obtaining health care. And that was my data.
Thank you, David. Our next speaker is Harold Edwards, President and CEO of Limonetta Company. Mr. Edwards understands the critical connection between healthcare, economic stability, and the long-term strength of our region. His leadership perspective reminds us that healthy communities are essential for a healthy local economy and future work. Please join me in welcoming Harold Edwards.
Just like to thank the Latino Town Hall for organizing this very important forum. So I'll go back to a long time ago, almost ancient history. My family moved to Santa Paula in 1970. So my father could establish his medical practice. He was an internist. And he practiced medicine at the Santa Paula Hospital for 33 years before he had a midlife crisis and went into hospital administration, where he became the medical director for the Ventura County Healthcare Agency and the Ventura County Medical Center. So healthcare has been very near and dear to my family and to me as we grew up. And I would just like to say, so I came to Santa Paula as the Chief Executive Officer of the Limonetta Company in 2003. And if you go back to the story that Mary Ann told about the challenges that Santa Paula Hospital had been having, I believe the hospital went bankrupt in 2000. 2003, it closed. And so we've been here before. And the modern and sort of nothing short of a miracle happened, where because of the leadership of Santa Paula, of the City Council, of strong members of our community, we were able to establish a very, very strong collaboration with the BCMC and the healthcare agency of Ventura County. When the money was raised, as Mary Ann told the story, by the county on the sale of the property next to the hospital, the creditors in that bankruptcy were paid 100 cents on the dollar. So that rarely happens in bankruptcy. But what it did is it opened the doors for a Santa Paula hospital to reopen, but at that point under the county's leadership and operation. And the county did a wonderful job and has done a wonderful job operating that hospital for the time ever since. Now, the world's changed, healthcare services have changed. I go back to 2004, 5, 6, when the hospital, 2006, when the hospital reopened. And at that time, Supervisor Kathy had a vision that was very consistent with what Mary Ann just talked about, of bringing better healthcare services down to the valley floor to make them more accessible for everybody in the Santa Clara Valley. There was just one problem. At that point, the estimated cost to build a new hospital was somewhere around $300 million that we didn't seem to have. So it remained somewhat of a dream, but fast forward probably 10 more years, when the decision was made at the California state level that all rural hospitals, all hospitals in California needed to be seismically retrofitted. And all of a sudden it created an opportunity where we knew that there was going to be significant investment required to go back into our existing hospital. And if you're going to put that investment into the existing hospital, why not consider taking that hospital down to the valley floor to make it more accessible and use the investment to create a new hospital? So at that point, the Limoneira Company began to collaborate very closely with county officials at the CEO's office and the head of the healthcare agency office about bringing healthcare services to the valley floor. The Limoneira Company has a piece of property that's 35 acres right across from Harvest Master Plan Community Development. It seemed to us that might serve that purpose just about perfectly. Located very closely approximate to the city of Santa Paula, very accessible to the citizens of Fillmore. And as we looked at the services that would be provided, our trade area was about 70,000 people that it would serve. So a real opportunity to bring healthcare services, modern healthcare services to the valley floor. And so Limoneira began to look at different models in which this could be accomplished. Given the challenges of funding healthcare investments, ongoing operational costs, and we found a model really quite interesting where a third-party provider would be able to create the financing and the construction on a build-to-suit basis for a healthcare operator who would then lock into a long-term lease to make the ongoing cost of operating on an annual basis affordable and sustainably viable. And we met an individual by the name of John Carneson, who has built numbers of hospitals and medical clinics throughout the Western United States. And we toured his facilities. We were very impressed with the quality of their operations, but maybe most importantly, the affordability and the sustainability of his models for providing accessible facilities to areas that lack the ability or the capital resources to write the check to build modern hospitals and modern clinical service buildings. So we established a partnership and engaged in conversations with the county, again at the healthcare agency and VCMC level, and went through a number of iterations. I think we probably went through 10. And at one point, it was going to be a 10-bed hospital. At one point, it was going to be a 70-bed hospital. At one point, it was going to be a 2-bed micro hospital. But we understood that that was a really important thought of the planning because this was a classic Wayne Gretzky situation where you don't play where the puck is, you got to play where the puck's going to go. And the future of healthcare is changing, especially on how people were going to be able to afford future healthcare. So as this was all happening, then the entire complexion of healthcare across the United States changed completely. And so that's really where we find ourselves today. So the Limoneira Company is very committed to the stewardship of our community. And it's critical that we have healthcare services in Santa Paula and Santa Clara. We're completely committed to that. Today, we still have the land, we still have the partnership with the build-to-suit financier for modern healthcare facilities. And we're open to a discussion or a dialogue with any healthcare operators that are interested in investing their time and resources and energy in Santa Paula. We're hopeful that that's the county, but given the reality of where the county is and where they find themselves with their healthcare services presently, we're not really sure whether that's going to be possible. It was important for me to try to tell that story to everybody tonight. We want to help. We want to be here to help and operate. And we're hopeful that it's the county, but again, we're not going to stop until we start to see healthcare service investments in Santa Paula.
Thank you. Our next speaker is Laura Espinosa, Chair of Gold Coast Town Plan Commission and past president of Santa Paula Latino Town Hall. Laura has dedicated years of service to expanding healthcare access and advocating for underserved communities across Ventura County. Her leadership continues to demonstrate the power of community partnership and public service. Please join me in welcoming Paula Espinosa.
Thank you, everyone, for being here for this critical discussion. When Dr. Bankhauser's office reached out to Latino Town Hall as he was making his rounds with other community groups in the city and the school board, we love the idea because we have a monthly meeting. Unfortunately, there's a diehard 10 to 15 people that show up every month. And in fact, our membership is much larger. We said part of our mission, of course, is civic engagement and getting the community involved, informed, and part of the decision making. So we offered to do this forum tonight and expand the history, for example, expand and elevate the voice of Dr. Bankhauser and the healthcare agency, and all of you expanding your voices as well. So that's what Latino Town Hall does. We do forums. We have 4 core issues. One of them being access to healthcare. One of them being access to higher education, affordable housing, and civic engagement. This is what we do for our community. So my purpose here, I am chair of the Gold Coast Health Plan. I've been there for 7 years. I'm in the beginning of my 2nd term as the chair. And I really want to communicate the message that the HR 1 bill will be detrimental to healthcare everywhere. And hospitals, not just county hospital, but every hospital will be impacted. All of us, regardless of whether you are a recipient of Medi-Cal benefits, will be impacted. Services in emergency rooms will be sky high because there will be so many people, hundreds of thousands of people who will be eliminated from the roles of Medi-Cal. So where else are they going to go for their care? They're going to go to the emergency rooms of whatever hospital they can get to. Hospitals are required to see them. Our county hospital in particular is a safety net and absolutely must see all patients that come through the doors. ER care is expensive, and it's more expensive than if patients are able to see their primary care physician and do preventive care instead of waiting till your diabetes, as Daisy said, or cardio events become a reality. So I know that all of you are very concerned, and that's why you're here. We would have wanted and committed to work with the county. It's a wonderful system, but I have to be honest with you, not only prior on a healthcare provider, board of directors, and president there, now on Gold Coast Health Plan, we have a messed up system. That's the bottom line. It's a broken system. It's not fair to the providers. It's definitely not providing the type of care that all of us as patients, when we become patients, deserve. There's lots of detrimental gains that go along with payments, slow payments from the feds, from the state. Providers, including hospitals, have attempted to budget for those types of problems. It's just becoming really unwieldy. It's been a long time problem, so nothing here that we're talking about is anything new. It's how we're going to address it. And as Mary Ann said, back in 2019, we partnered with the county healthcare agency and hosted town halls in Fillmore and Santa Paula. And overwhelmingly, all of our residents said, look, we don't want a glorified urgent care center. We want hospital care that is high quality. We want a healthcare complex. And that was the dream, and that was envisioned, and the healthcare agency and the county of Ventura seemed to be aligned with the constituents at that time. So the complex that we were expecting, because really Santa Paula is built out, we're 4.5 square miles, we're built out. So the area that is available is, as Mr. Edwards described, right over 26, 35 acres. It would have hosted and envisioned a whole complex of not only healthcare services, but area agency on aging, probation, public health. Every county agency that deals with healthcare and human services would have been on this complex. And in order to sustain it, would have been some senior living homes for market rate and assisted living, beautiful new hospital, it's a dream. And somehow this valley does not seem to ever receive the full impact that other communities get. And I'm not whining, it's the truth. You look at where are we with our community college system that you all voted for back in 2002. Here we are, 24 years later. We do not have that college center. And where are we today with our hospital? Well, the dream that we all held really looks like by 2030, our hospital could close because there is not going to be that retrofitting. And then HR1 bill, which is now being implemented, it's just going to kill everyone. And I say that literally. For us in the Valley, Ms. Daisy here participated in the every 3 years health needs assessment, and the county's own reports indicate that our lives depend on access to health care. We all know this, but what is so, and I'm sorry, Ms. Shira also talked about equity. We actually have a 10-year less, this went up here. Our zip code determines our health care. So Thousand Oaks, they live 10 years longer than somebody in Santa Paula. So for us, it is like that. And that is a question of equity. And so when the decision makers are determining the likelihood of closing this hospital, providing some level of health care, it needs to be as equal as every other community. We do pay taxes here, all of you, and I know I'm maybe gearing off a little bit, but I did want to talk about the elephant in the room. And equity is the elephant in the room, but also calling it out as the UCLA study that I recently read. It calls out racism. And racism is not calling an individual a racist. People need to get that clear. Nobody's calling anyone racist. Institutions who have barriers to equitable care, that is racism. It is that action. So this is what I say to all of our leadership. When you make these decisions, we are gauging it through the lens of racism. And so when you have 90% of the people in this valley as Latinos, 44% of the county in the last census, we are not getting equitable care in either education or in healthcare. So I will stop there, just food for thought here. The elephant will slowly walk out of the room for a moment. And what I do want to really emphasize on behalf of Local's health plan is there are new eligibility requirements to HR1. Now recipients will have to renew their eligibility not once a year, every 6 months. This is what you can expect to find for those who are recipients. I have family members who I care for, who are recipients, and believe me, it's not easy. The packet is complicated, and I think I'm an educated woman, but it's complicated. So having to fill that out for 2 people in my family every 6 months, I'm sorry, but that's excessive. But that's what the new regs say. Also, there will be work requirements. There will be exemptions for the age, exemptions for the disabled. However, there are also exclusions, and those would be for non-citizens. Through California's vision, we were able to expand Medi-Cal benefits to non-citizens who, yes, pay taxes as well and deserve to receive as a right. All of us should receive health care. But now that will be taken away as well. However, I really caution people, if you know people that are recipients, please ask them to not put this on the counter like I have done in the past and say, oh, I'll get to it in a bit, I'll get to it. And then you're there at the last minute. This is too important. You don't want to be without health care. The other thing that I would like to mention about the eligibility requirements are that Gold Coast Health Plan, the healthcare agency, other providers and stakeholders will be out there really pushing, trying to remind people, helping people with the completion of the forms. All of us can be good neighbors. If you know anyone, please have them renew their eligibility. This is so important. And I can't think of anyone who would say that healthcare is not their number one priority. I'll conclude with that. Thank you.
Thank you, Paula. Next up, we have Dr. Gary, founder and chair of the Bell Project. He's been a past president of the Tino Town Hall, dedicated years of service to expanding healthcare access and advocating for communities. And I do have to say, he's done a lot for this community, so to have him here tonight is, for the rest of our folks on this panel, is quite an honor, because this is the subject I think we all care about, and I hope we can move to a better completion towards getting something done here tonight.
Let me take a deep breath. I'm impressed with all the information you've been provided. It is a history. Yeah. This is like the first chapter. Yeah, I've been accused of having voice. Some people say that voice. Stop. So anyway, firstly, thanks to the organization. This is a long time coming here in the county, here in Santa Paula. So, and I wanted to recognize Pastor Mexicano in this case. And Pastor Mexicano has been providing this space for discussion and variation since 1934, 1935. So, so this is, we have a legacy here of bringing these kinds of issues community discussion. So I was asked to provide a proposal on behalf of the communities of Santa Paula, Pyro, and the overall Santa Cruz Valley. And this proposal outlines a minimum replacement of health, medical, behavioral health, emergency and support services required to protect the health and safety of the more than 55,000 people already mentioned, continuing to live this valley following the closure of Santa Paula Hospital. So for us, today, for us, the issue is electricity. That's what it is. We're trying to survive. And healthcare is a big part of it. And it looks like we're going to be victimized by the absence of these services. So here we are. So, is the hospital going to close? Well, yeah, they say. Is there going to be a facility to replace it? What we witnessed lately as the county walked between yes and maybe not. This may not be what Ventura County is verbalizing openly, but this is how we see it. It's already been mentioned in the Santa Clara River Valley's predominantly low-income Latino barriers, not only barriers, but conditions, chronic health conditions that victimize individuals here, residents, because of the lack of access on healthcare. So, closure of the hospital, which is going to happen due to geotechnical reasons, without comprehensive replacement services, we create a foreseeable public health crisis and deepen existing inequities that have been referred to just a little while ago. So for us, here in Santa Paula, in the Santa Clara Valley, it's about life and death. That's what it is. As was mentioned by Laura, we're already 10 years behind to other communities here. So how does that happen? And it's not that we want to die early. We want to have long lives, healthy lives, like everybody else. We're not asking for anything that we're not asking for anything more than other communities have. We're asking for whatever's fair. We want to be fair. And so far, for whatever reason, equity, racism, institutional discrimination, implied bias, whatever that is, we have not been getting it historically, at least since I've been here, and I've been here 7 years. So here we are again. It was mentioned earlier, 2 decades later, after the last closure when I was in city council in 2004. So on behalf of the 55,000 plus men, women, and children in the Santa Clara River Valley, we respectfully demand that county government, in partnership with state and regional agencies, immediately establish and fund a comprehensive replacement services that includes the following: 24/7 emergency stabilization and urgent care services, expanded primary care and preventive health clinics, maternal and pediatric health care access, behavioral health and substance use treatment services, mobile health care and telehealth access, medical transportation services, farm worker and indigent health care outreach, linguistically accessible and culturally competent care, and public accountability measures and community oversight. This replacement system needs to occur and be operational before or immediately upon closure to prevent dangerous gaps in care. As I mentioned before, this is life and death. Might not be here for you, but there are people here in Santa Paula. This is life and death. So why are these services necessary? We kind of appreciated the data that has been provided. You have the data, the company has the data, showing vulnerabilities with disproportionate rates of diabetes, hypertension, asthma, occupational injuries, internal health complications, mental health stress, food insecurity, and uninsurance and underinsurance. Here in the Santa Clara River Valley, Many residents work in agriculture, service labor, and low-wage industries without reliable transportation or paid leave. Requiring travel to distant urban hospitals effectively denies access to timely care and, in some cases, leads to an individual, a man or a woman, losing their job because there is no consideration for illness in some patients. So it's already been mentioned that the county has a long-standing obligation to protect public health and provide indigent and medically underserved residents and to address the critical needs listed above. This is a legal and a moral obligation. Failure to replace essential services after closure is in the only hospital in this hospital disproportionately harm low-income Latino and other residents and expose the county to increased preventable deaths, worsening chronic disease, overcrowded regional emergency systems, public health deterioration, potential civil rights and equity concerns. So what's the holdup? What's the holdup on delivering on this hospital that we need? Well, it's too expensive and it's not sustainable argument. Actually, if we lose the hospital, delayed care is more expensive. It's more expensive when chronic illnesses worsen. It's more expensive where emergency conditions become catastrophic. It's more expensive when preventable hospitalizations increase, and it's more expensive when digital emergency rooms become a problem. And hospital closure also damages the regional economy, as mentioned by Mr. Edwards. And neither does cost shifting eliminate cost. In other words, if you're not going to provide it here, we can just send it to another place. Well, it really shifts the problem to distant hospitals, which are already inaccessible to us. Emergency responders, county social services, and to taxpayers. So the shift is shifted, but it doesn't help. So the bottom line is the public ultimately pays more in healthcare systems. It's not about being more expensive. It's about taking care of business now, not putting it in. When you see a leak in your house and you don't take care of it, pretty soon you're going to have to replace it. Bottom line. So what could have been a $2 fix now becomes $2,000. This is how it goes. So here's what we recommend. To declare a rural healthcare emergency, because we are in an emergency, and we're looking at, we're facing a crisis, we need to act now. Prevent any interruption in emergency medical access and secure temporary emergency stabilization services. We need to do that right now. Need to collaborate to expand federally qualified health centers and community clinics capacity immediately by working with the customers providing training environment. Need to allocate emergency county health funding, conduct a health equity impact assessment, create a bilingual community advisory board, pursue state and federal emergency assistance, and publish transparent implementation timelines and accountability metrics. Last but not, it seems like the strategy has been to keep us off balance and uninformed, misinformed. Because I went to a presentation a few years ago where they put up all these plans. And I looked at my brothers and sisters and I said, this is it, we're there. And just a few months later, it was like, maybe we're not. It's frustrating. It's frustrating. But when my son was 5 years old, he had appendicitis first. And within 15 minutes, like I don't have that child. And the doctor said, if you had waited 5 more minutes, if you had allowed him to go to sleep before you brought him here, he would have been gone. I mean, that's how important it is. Personally, it hits me here.
When I look at my son, he's buff and he's strong, I say to myself, yeah, son, but where is that second going to be when your child has an attack of some kind that requires emergency assistance? So, in closing, the closure and replacement of hospital facilities represent harmful community by the county. Healthcare access is not a luxury reserved for healthcare populations. County government has both a legal obligation and a moral responsibility to ensure that public communities like ours continue to receive accessible, culturally competent, and life-saving resources. Any transition plan that fails to provide comprehensive replacement services will deepen inequality, will worsen public health outcomes, and place vulnerable residents at unacceptable risk. Our valley deserves a healthcare system that reflects our dignity and our contribution to the county and our contribution to humanity. We demand attention right now. Thank you.
Thank you, Dr. At this time, if there's anyone who has a question, Christina's asking to. Anyone has a question they've raised or would like to bring? Okay, at this time, we're honored to welcome Dr. Director of the Ventura County Health Care Agency. Dr. Frank Alder oversees one of the most important public healthcare systems in our region and plays a critical role in shaping the future of healthcare access, hospital services, and public health throughout Ventura County. Tonight's discussion is an important opportunity for transparency, dialogue, and collaboration between our community and county leadership. Please join me in welcoming Dr. Frank Alder.
Thank you. Are you all able to hear me? Great. Thanks for being here tonight, for your investment in the community, and for welcoming me to this dialogue. I just want to introduce myself a little bit. I'm a family doctor. My entire career has been invested in health equity. I spent a significant portion of my undergraduate time in South Sudan and then in Guatemala for a year. And after that experience, I came away with the interest in pursuing healthcare for everyone, where healthcare really is directed at everyone. And that concept that we call public equity. And I went to the University of Washington and then began asking all over the place, where should I train? I want to do primary care, where should I train? And people said, Ventura. If you're interested in health equity, if you're interested in global medicine, if you're interested in healthcare populations that otherwise wouldn't get good healthcare, Ventura County or Ventura County Medical Center has the strongest training program in the nation. And I'm proud to say that that's still the truth today. And I came down here in 1990, and ever since then, my entire career has been committed to health equity in resource limited settings, like our system, and it depends so much on federal government and state government funding. And internationally, I think some of you know me, know that I spent 5 years in West Africa during the Ebola crisis. That was the ultimate of resource limited settings. And then I also spent time in the very, very rural portion of South Carolina, working in a rural clinic there. Was that intentional? I think we have one of these for everyone. So I suggest that because the detail on these will be much easier for you to follow. I'll refer to this. I came here as a family doc trainee and became a family doctor. I worked in Magnolia and Oxnard, and then eventually ended up teaching this program and becoming the medical director of the hospital. And during that time, I began to work at St. Paul Hospital. I do advanced OB, so I took OB call at St. Paul Hospital probably 5, 6, 7 nights a month for between 2007 and when I left for Africa in 2013. And I did weekend hospital shifts with Dr. Constantine. So I spent many hours in St. Paul Hospital. And grew to love that place. My own personal patients, I encourage them to deliver there. It's an older hospital, but the staff is extraordinary, incredibly personal care. To today, it's an extraordinary place to get care. So I just share that to share that Santa Paula Hospital is important to me. It is dear to me. I spent a lot of time there, and it is important. And that's where I'm coming from. I became an administrator, and Harold's father, Dr. Sam Edwards, who was very good teachers that were at it's allowed me to have impact and influence towards using our limited resources to make an impact on the largest number of individuals, particularly paying focus on individuals who have barriers to care, who otherwise might not get care. That is what my career is, my vision for my career is. So today, I just someone asked me, and someone would ask me, what's your goal? My goal is really to share an update, to let you know where we're at. I wanted to share challenges with you. We continue to have challenges at St. Paul Hospital, but I want to share a little bit more detail about those. And then I want to give you an update on what our intent is for the next steps in kind of working through what to do for health services that the county provides in St. Clair Valley. And finally, just kind of address one specific question which comes up in many forums, and that is the care of the emergency, and just give you some details related to emergency care. So I'll start with that status update. We'll talk about funding this HR1, referred to as the one big beautiful bill. There's nothing beautiful about it, so that's the last time I've ever referred to it that way in this group. And it's called HR1, House Resolution 1, and it's massive cuts to the Medicaid program. Medicare is for elderly and people with long-term disability. Medicaid is our income-based, federally supported, with a portion of that managed by the state health plan. And Medicaid was founded in the 1960s, and HR1 has provided the largest cut to Medicaid in the history of the program. We'll talk about St. Paul Hospital, who's using it, how it's being used, some of the financial challenges there. And then I just want to review some of the extensive investment in healthcare that the county of Ventura has and continues to have. So we go to the first slide. My first, the most important message: St. Paul Hospital is open, it is thriving. There are lots of people coming to our emergency rooms. We have a very strong imaging department. Nurses out there, physicians out there that work at both campuses, and the ED is staffed by the same doctors who manage our trauma center, and it is a hospital that is ready to care for you and your family. I We do have an inpatient service. There's not an OB service, but there is an inpatient service there. And we'll talk a little bit more in detail about some of that. The next slide I want to share with you is just HR1. And the sobering reality is that in July 2025, the federal legislature voted in a bill that cuts almost $1 trillion from the Medicaid program in the next 10 years. In the state of California, that translates to about $930 million cut in 2026, which is huge, but small compared to the ultimate cut, which will grow to $3.4 billion for California's public hospitals by 2032. And that's a statistic that the California Association of Public Hospitals provides. You can see the numbers on the sheet here. I'm not going to read them year after year, but there's an incremental increase in cuts year over year over the next 6 to 7 years. And then kind of stabilizes out to, in our system, about $130 million a year. So over the next 6 years, that translates to over $400 million of cuts from the BCMS system. And that is going to change things for us. There's no way for us to absorb that kind of a cut of federal support without, changing something. And we have plans. I believe that it is possible for us to sustain a publicly funded healthcare system in Ventura County that provides high quality care, but it won't be done without some consolidation, without some efficiencies, and without sometimes. So I think we're kind of working through how to do that. As you can see, this year the cut is not, I hate to say small, it's actually more feeling it, because this year we anticipate that $3 million cut. But it grows year after year after year. And if we're careless and not and just imagining that this is going to go away, we'll lose our publicly funded healthcare system in Ventura County. And that just can't happen. There's too many people who depend on it. So I just want to share now kind of specifics about Santa Paula Hospital. If you look, we really have a reduction of the utilization of Santa Paula Hospital. And you see a reduction of patient days. Some of that, about half of that is related to the closure of the OB and ICU. You see our average daily census, which was hovering around 14, 15 back in the 2010s. It's now dropped to 9 last year. Last night at midnight, we had 5 patients in the hospital, so full service hospital with 5 patients. You can imagine how hard it is to make ends meet in that setting. We have 7 this afternoon. But that number has continued to drop. We've seen market shifts. I think it was mentioned that after the 2019 reopening of the OB, there was a very public commitment to providing 10 OB patients a month for clinicas. And that number actually turned out to be about 2. And despite push and pressure, stakeholder engagement, Clinicus continues to send their patients to St. John's Hospital. We've seen our largest private hospital or healthcare system, the Valley Healthcare, the Valley Care Physicians, have Dignity, the mother company of St. John's, purchased their hospital. And then, of course, the CMH clinics, they're there for kind of the outreach in the community, and then those patients, when they do need to be hospitalized, they go to that CMH. And I'm grateful for my CMH colleagues being here and just recognize the impact of the community. But the reality is that we're rural, really close to Ventura, really close to Oxnard, such that the federal government doesn't consider us eligible for most of the grants that are available for hospitals. Surgery, on the other hand, we keep driving numbers about surgery. The surgery, the department is busy. People, the staff are very efficient. Surgeons like it there. Patients have a great experience there. And so we have had the ability to control surgeries and have seen year-over-year growth in our. If you go to the slide with the purple columns, just to share a little bit about the acuity in the emergency room, we continue to have a good model. Anyone who says that the community doesn't know the Santa Paula Hospital is there, I challenge them to explain why we have such a busy emergency room. There's, any one day, 40 to 45 patients who come to the emergency room at Santa Paula Hospital. But year over year, we've seen fewer and fewer of those be of the acuity that they require hospitalization. Our hospitalization rate is down to about 5% compared to 12% in BCMC. So we have seen the emergency room well utilized by the community, but certainly lower acuity than you would find at CMH or BCMC. The hard truth is really the financial challenges at Central Hospital, and especially as we look at the upcoming impacts of HR1. What you see on the left-hand box there in the blue is the revenue, and in the orange is the expenses, and that difference is displayed on that right box in the red boxes. We did see some drop from 23 to 24 as we drove the surgical numbers up. We got a new CT scanner. We did see some increase in that outpatient volume and got some improvement. And then from 24 to 25, fiscal year 24 to 25, that $4 million savings or the decreased loss that we were anticipating by closing the ICU unit will be did indeed happen. So we were able to mitigate some of the loss with the closure of those two departments. One of the state requirements, again, this is kind of like an HR1, this is imposed on us, and it is that the hospitals, even small rural one-story hospitals, have to meet seismic requirements to survive a large earthquake and still be able to give patient care, irrespective of the inpatient volumes and how easy it would be to transfer patients to the facility. That requirement at BCMC happened just about 7 years ago. The requirement was much earlier for the larger hospitals, and in rural hospitals, they were able to push it out to 2030. The cost of that at Santa Paula Hospital is $25 million. So we presented that cost to the Board of Supervisors in the context of what we already knew about HR1, the anticipated impacts of HR1, and the Board of Supervisors, following the advice of the district team, really decided that that was not the best utilization of our fiscal resources in this chapter, and decided to not seismically retrofit the building that was built in 1962. So that is, at that meeting, we were charged with looking at other healthcare delivery models, everything from urgent care to I don't like this term, it's not my term, it's in the literature, micro hospitals. We like calling it an essential needs hospital. It's simply a hospital that has the minimum number of beds required by our state law and a fully functioning emergency room with or without an operating room. And so that would be one of the models we take a look at. And we are engaged with a very, very experienced consultant, management associates, and we are developing a financial pro forma of those three models, the urgent care, expanded hours, emergency center, and a micro hospital. And anticipate coming back to the Board of Supervisors with that presentation of that pro forma in August. It may be early September, depending on, some of the elements that the schools are putting together. So that we anticipate that coming at the end of the summer. But, I wanted to just reflect where are people going? And what you see in this pie chart is that this is from 2024. Remember when the average census of the hospital was 11, and now the average census is about 8. So in 2024, 23% of the patient hospitalizations from people who resided in zip codes that included Santa Paula, Fillmore, and Highland, 23%, so less than 1 in 4 of those patients were hospitalized at Santa Paula Hospital. Another 1 in 4 were hospitalized at BCMC, and the remainder were hospitalized at other regional hospitals. Most of them COH and St. John's. Some at Henry Mayo. I told you I kind of review some of the healthcare services that the county does provide. And it is pretty significant. If you flip to the page that has the 4 columns of text, what you see on the left side is our ambulatory care. That's the term that we use for our clinic system, primary specialty clinic system. That's ambulatory care. And over 11,000 patients, 43,000 visits in 3 Santa Paula clinics and 1 Fillmore clinic. Very busy. Our behavioral health department that manage mental health and substance use have very busy clinics in Fillmore and Santa Paula. The hospital, of course, we've talked about, and then our public health department has a WIC program in Santa Paula and 43,000 visits yearly. So very, very active county services here in the area. Finally, I kind of wanted to review is this is really in response to repetitive questions about emergencies. And what happens if there's a big accident on 126 and Santa Paula Hospital's not there? What happens if someone's having a heart attack and Santa Paula Hospital's not there? I just want to reflect that there is a very significant body of literature that demonstrates that patient outcomes are better. Better if they get in significant trauma and they go to the nearest trauma center, not the nearest emergency room, the nearest trauma center. And in the case of heart attacks diagnosed in the field, they go straight to a hospital that has a cath lab. And in our region, that's a community memorial hospital. So those patients, they bypass them. They don't come to Santa Paula Hospital today. Sometimes people will drive in their cars and they'll end up there. But EMS finances today, those severe conditions. You see in that hospital services, this is just kind of a demonstration of why that is. You see that, basically at BCMC, there's a significant augmentation of services. We have people who are on call who have to be either in the hospital, anesthesia and surgery, or within 15 minutes of the hospital, when it comes to neurosurgery, ENT. There's just a much quicker access to higher levels of care that are required for some emergency services. And I can leave Memorial Hospital, there have a cath lab ready to go so that patients who deal with that heart attack can go straight to that clot busting step. Some people were concerned about whether EMS is really responsive out. There was delays in the ambulance, so we actually pulled it down. EMS, they had to actually look at it themselves. But what it really demonstrates is the response times in Santa Paula and Fillmore are similar to everywhere else in the county. EMS puts 2 rigs here in Santa Paula, 1 rig out in Fillmore, and they stage 1 rig in East Ventura, so that so that basically one of the rigs leaves this region, another one comes and replaces it. So they are really committed to making sure that that response time is very rapid. And that was the answer to a specific question that was posed. So finally, I just wanted to kind of let you know where we're at. Santa Paula Hospital is open. I would welcome you to use that hospital. Phenomenal staff, super personal service, booking in and out of the emergency room, a lot of injuries and illnesses, and that hospital is here and ready. We continue to operate that hospital through the deadline, January 1st, 2030. We'll return to the Board of Supervisors in late summer, like in August or early September, and share an update with regard to the performance that were requested, looking at various options. And then in this interim time, I will be meeting with anyone who would like to be informed, would like to be updated, would like to get a message, would like to know where we are today. And on the bottom of the sheet, you have contact information for Dr. Collins, who's our public information officer. She can arrange for those public meetings. No group is too small. I'm fully available. So if you all are meeting and you have a group who would like to hear this message, needs to hear this message, needs to be heard, needs to share with us their input, I would be there. So I just want to make that really clear that this is the process of engaging with you all. It's a difficult time. It's a challenge to figure out how to use what has become extraordinarily limited resources relative to the last few years. We're trying to meet that challenge with health equity in mind, making sure that we're mindful, particularly of people who have barriers to care, various reasons in our area. The vast majority of that is cultural and language reasons. So just wanted to share that with you and also express my gratitude for you all taking the time to be here tonight.
We will now transition into our panel discussion and committee Q&A session. This is the opportunity to share concerns, ask questions, and advocate for the future of healthcare in Santa Paula and the Santa Clara Valley. We ask everyone to remain respectful, focused, and community-centered, and we'll move into this dialogue together. I'm going to go ahead and start with the first question, and then and this is for Dr. Frankhauser. We've been at this dialogue for a long time. At one point, we were told a physician makes about $80 a visit, clinic makes about $250, and the county healthcare agency gets about $1,000 per visit per patient. And so with that, we also know that some of the county systems could be updated to track patients better and do other things to turn around. So my question is, with HR 1 happening, what is the agency's actual 3 to 5 year term?
Thanks, Richard. So some of the financials of that is something that is, I don't have the per visit numbers, but I can tell you that the county seeing 60 to 65% is represented how large our Medicaid population is, or Medicaid in the state of California. That we year after year have a very thin margin relative to our private partners. partners, our private colleagues, and we operate as efficient as possible, as mindful of collecting the available federal funds as we can, and really doing everything that we can to operate a system that uses its resources wisely. Stewardship is a critically important goal and value to our leadership team. The three-year, and I heard it term turnaround plan. We tend to use the term strategic plan, and we're in the midst of that. I think we have shared with you some of the very large barriers to that, and we will have kind of strategies for how to negotiate this next 3 to 5 years. Sustaining a system that is critically important to all of our county. We're the only inpatient pediatric ward in Ventura County. We have the only pediatric intensive care unit in the county. We have very busy OB department that takes care of predominantly Medi-Cal, our state's Medicaid program, Medi-Cal patients. And we are the county's trauma center and one of the county's stroke centers. So for us to sustain what the county operates for a patient population that otherwise wouldn't get good care is critically important. And that is certainly at the forefront of our strategic thinking. As I mentioned, it will not happen without some changes and some consolidations, some restructuring of service lines, and that is something that has to happen. We can't absorb a $400 million plan in the next 6 years without those kinds of changes. So I hope that answered your question.
I have a couple of cards here that are direct comments from some of our residents. I was born in LA and moved to Santa Paula when I was 2. Santa Paula is my home and I'm happy to bring my story to the community. My healthcare was monitored here in Santa Paula growing up. Now I am a healthy, happy mother who gave birth to a healthy son at Santa Paula Hospital. Unfortunately, I had to give birth far at BCMC for my daughter. I would have loved to give birth here instead. I am grateful for the care of my children. My son is 2 and my daughter is 7 months. It would break my heart for the hospital to be closed. Let's have faith that may the hospital remain open for many years. Thank you. Another resident. I live in District 4 in a multi-general home that includes a 3-year-old with a trach and ventilator. How will Santa Paula, Fillmore, and Peru be able to access emergency and on-call services to Santa Paula? What is the plan to protect medically fragile residents and so that our communities are not left without oxygen?
I shared some of that plan. I guess I'll reiterate some of this. I think that right now, the high acuity illnesses, contacting EMS 911 and getting them to triage in the field. They respond very quickly, begin therapy in the rigs nowadays, and they get to the nearest appropriate facility, which sometimes is BCMC, and the critically ill child who's going to need to be on a ventilator. The best place to go is to get to BCMC as soon as possible via EMS, and then I think this is again a closure that would happen in 2030, and in our plans, in our scheme, we're taking a look at other things like medical transportation, as mentioned, I think, and just looking at what would that cost? Is that something that the appropriate stewardship of our limited resources? And I think we also have partners in the Gold Coast who's working through this just as rigorously and as diligently as we are. And Gold Coast is now where a large portion of our Medicaid, Medi-Cal dollars are funded through. And Gold Coast has programs like medical transportation that they anticipate augmenting, just so that, residents can get to the nearest facility. So yes, and we do have a little bit of a runway. We're talking about, 3.5 years from now. So we will be working with our partners in that service to the Medi-Cal population to provide the kinds of services that people who are living on a limited income might otherwise not have.
Okay, next question, Dr. Frankhauser. Can you give data on the amount of transfers that leaves Santa Paula Hospital after they've been stabilized? The number you provided for the amount of patients in the hospital last night was 5. Was that only on the floor? What was the ER census? The ER census and activity varies, but do the sick patients get transferred mostly because of lack of specialty services that have been cut?
I'm going to ask my colleagues to give us an estimate of the number of patients that are transferred. But it does not add up to the difference between those numbers, that's for sure. The number of patients in the hospital, irrespective of whether they were admitted and being held in the emergency room or they were admitted in a 4-bed, that number was 5 at midnight. Both of those counted in the census. And the number of emergency room patients is significant every day and every night. As I mentioned, the emergency room is busy, and I don't think it's slowed down in this last week. What would you estimate the number of transfers from BCMC? Joy Reed is here, and she is the nursing director, the nursing manager at the San Antonio Hospital. That's supposed to be that.
Sure.
So, yeah, and the question is how many of those who are admitted are transferred to BCMC or CME?
Our transfers are very dependent, so sometimes we have 4 a day, others we have 0. I would say we average about 2 a day of transfers out to. So 50 a month is what giving us kind of thing that we average.
Did everyone hear that? So, and so that just reflects, it's not that's not failure of any kind at all. This just reflects that there are certain patients who come into that emergency room who need services that are available at CMH or BCMC. Some at St. John's. St. John's has one intervention that is a special type of stroke intervention with an intervention neurosurgeon that requires lighting imaging. But it was in the vast majority moved to BCMC and CMH.
Good evening, everyone. Just a couple thoughts of my own. My name is Rafael Aguilar. A little about me, I'm raised down in Santa Paula, University. I was therapist at both Santa Paula and I do call my home very smart. I'm here today because I strongly believe that the Santa Paula Hospital, as well as emergency medicine, for the past Santa Paula has experienced tremendous growth. And that extends beyond our city limits to neighboring communities, such as Fillmore. More families, more residents, and an aging population all meeting greater demand for accessible emergency and hospital-based care. Through my work, seeing firsthand the positive impact on Santa Paula Hospital has had on the community. I regularly care for patients who express immense gratitude for the services available here. Many have told me that having care close to home has been life-saving for them and their families. For seniors, working families, and those with limited transportation, local access to emergency and hospital services is not simply convenient. It is often the difference between receiving timely care and facing potential devastating health. As we discuss the future of healthcare in our region, I believe exploring and expanding opportunities and services such as behavioral health. Not only will this address a critical and growing healthcare need, but it could also attract additional funding, create long-term financial stability, and help support the continued operation of comprehensive emergency and hospital services in our community. Above all, I want to emphasize that emergency medical services are essential to residents of Santa Paula, Gilmore, Piper, and surrounding communities that have access to life-saving care close to home. Every minute matters during the medical emergency, and preserving these services is an investment in health, safety, and future of our entire region. I urge our leaders and stakeholders to remain committed to ensuring that Santa Paula continues to have the emergency and hospital services that the community depends on and deserves. Thank you for letting me speak.
Good evening, everyone. My name is Cynthia Slammer, and in my capacity, close to the mic, is that all right, looking to the mic. This is a question I've asked several times, and the times that we had the Blue Ribbon Committee about the potential of working together, purchasing collaborative support systems with agencies, with other companies that potentially could require no additional tax. I'm interested in knowing how the county has explored or will consider exploring, possibly looking at large companies to see if they could in some way purchase for healthcare that feeds into the healthcare system and would sustain the public system. So instead of looking at the dollars that come from the state, how are we looking at our other agencies to say, hey, how can we partner and be your provider? That would allow for the public system to be sustained. Another consideration is looking at the grading and funding. A lot of our school systems, as well as higher ed institutions and other companies, would be an opportunity to look at what fundings overlie and how to bring those resources together. An example that I'll give you, even though I'm not here in this capacity, I'll make that clear as a board member. One of the things we were looking at the local community college is taking extended learning opportunity funds and ACES funds to see how we could fund programs at the local community college that would in turn come back to the local school district to support college-going resources, given the impact of federal dollars under this administration. So I think, like similarly to the pandemic, where we all worked collaboratively to support our county and our community during those times, we really need to sit down and think innovatively and not stay in our lane. What's my dollars? Whatever. Let's look at how we can sustain each other locally, and then look at our government structure just for your consideration.
We're gonna probably read about two more questions, and then I just want to give it a chance for the panelists to give last.
Hello, everyone. Thank you for being here. My name is Kate English. I've been a resident of Santa Paula for 26 years. I just want to come back to a point that Paula had made about structural racism. Santa Paula is one of two cities in the county that was actually segregated. What that means, what structural racism means, what she was getting at, is that it doesn't require an individual racist person to exist. It's the way that history is impacting the present. And our economically depressed valley ends up with economically depressed schools, ends up with generational poverty. And we also are a farming valley, and people here in exploited labor who have less access to healthcare and less going forward. They have to be treated at emergency rooms when they're having life and death crises instead of having which gets more and more expensive as we move into this HR reality. So these are questions that you don't have to respond to right now. They're more just because I'm a realist, and if we're not going to have a hospital after 2030, and we're thinking about how we can have the most equitable healthcare system in this valley, and I do believe the healthcare agency wants to partner us. They have in the past, they reopened up with me when we demanded it. It does feel more and more lately though that we just get updates after the fact. Collaborative involvement. So my real hope is that as we think about these options for the valley, as we have a consultant looking at it, the county has a consultant looking at that. Having that consultant talk to the community, having the community input into those options. How much influence can you really have moving so quickly to the board of supervisors? And when are we going to get farm worker input? Because I don't see a whole lot of farm workers maybe in this room. I don't know for sure. But, we need input from our farm workers themselves. We need to go to trusted voices to be able to get that input. We can't just hold a forum and ask them to show up, especially in a moment when immigration is dealing with families. And also the Santa Paula Hospital Foundation. I'd love to see them deeply involved in fundraising for this crisis. I haven't seen them. I don't think, is there anybody from the Santa Paula Hospital? Okay, thank you for being there. We want your what could county invest in? Many counties invest in their public health care systems. So I'd like us to really think about what could that look like in the future. Creative ways of thinking about the funding for this. Thank you very much.
We have question cards here. And so I'm going to ask Dr. Frank Hauser, if we type these up, email them, if you could get us the answers back.
Not tomorrow.
Not tomorrow. So if you did write a question card, please make sure you put your email on the page back there. We're going to type up all the questions, share them. We'll get the answer, and then we'll do an email blast so everyone has answers, the questions they want answered. Okay, we're gonna go with 3 more questions real quick, and then we'll go ahead and have last comments by our panelists.
Okay. These are shorter questions, so I'm going to give you a blast that you can respond to right now. Who is being held accountable for financial performance? How will the agency compete with private systems? What projects might be delayed or canceled? How are you going to recruit physicians and retain physicians? And what specific reforms are being implemented immediately?
Thank you. I have to ask you to break that down. I'm thinking about this questions. I think if you would allow me to consolidate it and create that I think a lot of the questions are very, very similar to each other. So, some of the questions that you asked were, who's holding us accountable for being good stewards of the funds, and we are public. I would say the public is holding us accountable through the Board of Supervisors and the Turkey CEO's office. We have public reporting of finances and very detailed public reporting of where our expenses are. And I think that what we see, if you caught the most recent budget report, is that among all public hospitals in California that are expenses per patient fall well below the median for public hospitals in California. I think we operate a very efficient and are very mindful of our stewardship. How do you recruit physicians? I'm just going to say this is something that has been remarkable to me. There are still a lot of people who go into medical school to do what I do. I'm now kind of coming in the sunset years, right? But what a remarkable way to invest a career, to have an impact on patients and otherwise get good care. The kind of colleagues you get to work around, is really extraordinary. And there, what we say is excellence begets excellence. We have a hospital where our surgical outcomes are in the top 10% of all hospitals in the United States. We have a hospital that year over year gets its stroke certification in Arnold for its management of diabetes. We have a nursing team that is second to none. And that's how we get good doctors, because good doctors want to come work alongside good doctors. And that has been how we've done it since I was an intern. And I think we'll continue to see exceptional people join our system. There were a whole series of questions, and I'm happy to answer.
Maybe we could wrap up with, this question about specific reforms that are being implemented immediately, and the other question I'm concerned about reforms that might be delayed or canceled. We're more in flux or change. Can you speak to that?
Yeah, but it's complicated, right? So HR 1's not going away. There's not a reform that's going to just eliminate HR 1. That doesn't happen. We have seen some federal cuts. There's something called DSH, disproportionate share hospitals. That's funds that go specially to hospitals that have historically more than 50% Medicaid. It's dropped at years to 40, but a disproportionate number of Medicaid patients. And those cuts were supposed to be implemented in 2011, and they've been pushed back year after year after year. We are hoping for legislation and reform that pushes some of these HR cuts back. It's not pie in the sky to expect that we'll be able to thwart some of these cuts. I just want to credit Dr. Johnson, who stood up here briefly, but our county CEO was in Sacramento last week, lobbying for the state to fill some of these gaps and for us to push back against some of the measures. So I think we have an organization that's an organization of counties, an organization of county healthcare leaders, an organization of public hospitals. All of them have very aggressive advocacy programs, and we're participating with them so that our voice can be heard. This is a group of patients in Santa Paula and throughout Ventura County who really need our hospitals. And so I feel like that is something that we will continue to push for. And HR 1's coming before 2030. We have to be mindful of the really short-term impacts of this really horrible. Thank you for that. It's the opposite of equity. It's really legislation that is to drive healthcare away from those who need it most.
I want to thank our panelists, and we're going to have them end this evening with Paula, if you would please get started.
Community wants Ventura County healthcare to continue to succeed. Public health is essential for all of the families, Medi-Cal recipients, and local residents. Some years ago, County Hospital Association went to the state and wanted the transparency of their finances campaign. I don't know what I can get this right. So now you used to be able to go and look in certain areas and look at county hospital finances. That's not prohibited. So it really speaks of not just this hospital, but hospitals statewide and their lack of transparency. You are not going to find the exact numbers that we would see in an open, transparent system. However, our hospital system here, I will say that there's goodwill. People do want to be upfront and share what they can share. But goodwill alone is not a strategy. The community deserves transparency, accountability, operational excellence, and leadership with a real vision for sustainability. The question is no longer whether change is needed. The question is whether leadership is willing to make it happen before the financial situation becomes irreversible. What is the real plan for Santa Paula Hospital and for county healthcare services in the Santa Clara Valley? That's the bottom line. We've heard 3 options this evening, but it's really, that's not clear. And by August, I don't think it's going to be clear, but perhaps with an extension and more dialogue, we can really get to the meat of this. And thank you very much for everyone's participation.
Next.
Okay, I'd like to just take a couple of minutes to share some recent things, medical issues that have come up in the community, and people have asked me to share with the county and with the community. One of them is a friend who has a son who is highly allergic to bee stings, and he's only 8 years old. He has his EpiPen with him at school, but the EpiPen only protects him for about 20 minutes, and then he needs a higher level of medical intervention. They specifically moved to Santa Paula because the hospital was here, and they could not move to Fillmore because that's too far for them to get the help that they need. Are people actually going to have to move who have these unusual medical conditions? That's one problem. Another one was recently, I think it happened about 2 months ago. There was a farm worker woman who was in labor, and she knew she couldn't go to Santa Paula Hospital to deliver because the maternity ward was closed. She was walking into businesses asking for help. Someone offered to call an ambulance, and she felt that she did not have money for an ambulance, and that wouldn't work. Someone managed to call a nonprofit, and they found a ride for her to answer that train. But that's just an unacceptable situation. The third instance was a woman that a number of us in this room know, who lives in a senior facility, an apartment building. She was having a neurological episode. She managed to call 911. She was losing part of her vision. It was obviously something neurological. The paramedics took her to Santa Paula Hospital. They didn't take her to the stroke unit at St. John's. And when she got to Santa Paula, they did some testing, some evaluation, and decided to be transferred. We often hear from the healthcare agency that people are immediately taken to other hospitals in that circumstance. That was not the case. And so we need to balance the reality with what we're hearing, because it's not always the same. And then the last thing I wanted to say, and this comes up from the community over and over, and it came up to me before the call this evening. Santa Paula Hospital was built on donated land with money completely donated by the community. It's one of only a handful of hospitals, maybe 3 in the whole state, that were built that way without any public money. The loss of healthcare to the community would be really, really significant, but the loss of that investment would also be really significant. And the point that we've tried to make with the Board of Supervisors, and we want the community to also make it important, is that if the hospital is sold, any funds derived from that need to be reinvested into healthcare for this family. Thank you.
Once again, I'd like to thank the So we all know that good healthcare services are in part bricks and mortar, but mostly it's the excellent doctors, nurses, medical staff that are critical to keep a healthcare system viable and sustainable. Merit is committed to not only facilitating the hospital clinical services, but committed to bringing skilled nursing as well as assisted living. And if we really are thoughtful about this, to bring housing for staff, as well as student housing for an education component to this, it's not out of the question to make all this happen. We just hope the county has this in consideration when they're thinking about what they can do, what they can't do, but we can't do for August.
I just want to thank everyone for showing up and for all of the questions that we received. I appreciate everyone's time. And some final notes, all of the data that I had shared earlier is publicly available. If you look at the Ventura County Health Needs Assessment, you'll be able to find all of that data. If you want to go into it and look for any other data or any other concerning health needs in the community as well.
Thank you. I just want to express gratitude for being here. It's very helpful for me to hear from the community, to engage with the community, and these are challenging times. And we will continue to make decisions being mindful of the community that we're serving. Thank you.
Yes, thank you for coming down. So the center of the university is adequate to. So today we talked about care issue. For us as a collective community, it's about the elderly, taken care of. We have quite a population, so we need infant care, children's care. So today it's about collective survival. Also, I think that there's going to be an impending gap in health services. If we look at the timeline of construction, we have to decide right now that we're going to go after the money. And then after we secure the money, that we're going to design and plan a hospital, and then we actually go to vendors to construct it. It's not going to happen. Not going to happen. It takes longer than that. We haven't even made a decision on property that is available for years. So expect a gap in services. And with that, it's kept some specs against what health overall. So the closure and non-replacement of medical services for our community, I perceive it as an abandonment of this community. It's happened before, and it continues to happen. So for us, the big bad beautiful bill, if we don't watch it, then there's elections that are coming up. We need a new administration, so we need to collectively move forward in that direction. We want to help repair some of the damage that's being currently done to our community. So, Mr. Edwards mentioned that there was a possibility of looking beyond the county. Some perceive it as the only game in town. It's not the only game in town. There's other players that we can we need to contact. My question would be, would the county look at potential partner other than the hospital in the county system? Would you look at this as a turf issue where, you know what, we're going to do it on the phone? Or are you going to meet your legal and moral obligations, work with others to provide residents of the valley high quality, adequate healthcare in collaboration and partnership with perhaps other providers. We will go with that case. So the land that Harold is company right now is very, and we could secure it through an investment. We could secure that, and it's that land, that investment, going to be profitable or not. I guarantee you that it's going to grow in value. With an investment in something happens like if you open then you can sell it at a profit. The county is in a win-win position as far as the land is concerned. And so I myself am very concerned about this. We've been working at it for 2 decades. And I hope that in a couple of years, 3 years, we can try to build some kind of facility. We have a company that says and has explained it well. I mean, it's a logical argument that this company made that when the county finance director goes to the board of directors, goes to the public, and says, you know what, this hospital is going to cost $300 million, $400 million, $500 million. You know, it seems unreachable. It seems like. However, if you have a potential company potentially build it, modular development design, or half or a third, whatever it costs, shouldn't we, the county of supervisors, shouldn't we be considering those kinds of offers? Up until now, these individuals have not been allowed to present them because, you know what? Ultimately, it's we have elected representatives that are obligated to represent our needs and interests, and so I think they allow this. And the way that you fight, you develop that, you will become politically involved and pressure our elected representatives to do the right thing. And friction yet. So I want to thank everybody for being here and for this man right here for helping organize this. Organizations. And once again, beautiful here in San Paulo. I want to continue to live here, healthy lives. I want my children to be healthy, my grandchildren to be healthy. And we need to act now because if we don't, thank you very much.
I want to thank all our panelists. Let's give them a big round of applause. The healthcare agency, members of Santa Paula Latino Town Hall, and our other partners. We had organizing committee built on different members of the community. And I want to thank everyone here for that. And I especially want to thank the city for helping us out with getting this filmed, helping us out with the sound. This will be on channel 10. And so please look out for it. And YouTube, okay? So again, all the questions that weren't asked, we are going to type them up. We're going to share them with Dr. Bankhauser, and he'll get them to us in about 2 days or so. But we'll work on that, and we are going to do an email blast with the question and the answer. So if you do have any last-minute questions, please feel free to go to the back there, fill it out, make sure we got your email. And guys, this is going to take our community, it's going to take a collaboration, And I think from what we've heard tonight, we're off to a good step forward, but we need you to stay involved and keep this moving, because if we don't have community input on this, we are not gonna have it happen. And it's up to us. So thank everyone for coming out. Guys, hold up, before you leave, we could not do this without our hosts, who have a long tradition of hosting these kind of forums. So I especially want to thank the Casa de Mexicano. And in the tradition of all the events that happen here at the Casa, if you were sitting in the chair, you are willing and able. Please feel free to stack that chair back there. Thank you. Have a good night.
This has been a Rough Edge Studios production.